stick his hand in and squeeze the heart with his hand. It was very efficient. It's actually more efficient than closed massage. But it was also very invasive, very aggressive. And there was a certain mortality, death, and morbidity, meaning bad complications, with that kind of massage. Today, still, in the operating room, we use open massage if the chest is already open and the heart stops. It's also another way to start the heart. But in the absence of an open chest, we still go to cardiopulmonary resuscitation, in which, as you probably know now, we press on the sternum. The sternum has some give in it because of the ribs, and we are pumping the heart against the backbone and the sternum. The blood output is about 80% of what you can get if you did it by hand, but it's still adequate for good circulation and to resuscitate a patient. The next topic is the pericardium, the coverings of the heart. And this is a subject which is good to dwell on at this point because it's going to be very much related to other coverings in the body, and a good understanding of the embryology is really very important. The heart isn't sitting there in the cavity by itself. It's not sitting in the chest free, but as you can see, the cut edge here in this plane has a little sac around it called the pericardium. Pericardium, meaning around the heart, is a tough, fibrous sac that holds the heart in place and gives it some protection. It also protects the heart from overexpansion in diseased states. This is a two-edged sword. And the way it forms is really rather interesting embryologically, and it's exactly the way the coverings of the lung form, the pleura, and it's also analogous to the way the coverings of the intestines form. So it's worth a minute to look at that right now before we go ahead. If you can imagine yourself sitting in a closet or a coffin or a small room, and you represent the heart. And if you were to take a balloon, which is going to be the coverings, and start blowing that balloon up, the balloon would expand away from you until it reached the walls of the enclosure you're in, let's say a closet. It would then, as you continue to blow, press against the walls and line the walls, floor, ceiling of that closet. That's what we call the parietal pericardium. It is the wall, parietal means wall, covering. If you continue to blow, what's going to happen? The balloon is going to start coming back at you and press around your face and body as it has no other place to go. It's eventually actually going to meet behind you. That very thin layer that's covering you is what we call the visceral pericardium, and it's tightly adherent to the heart itself. Now think about that space. There's now a space between you, covered in this thin layer of pericardium, the visceral pericardium, and the wall, the parietal pericardium. And that's exactly analogous to what we have in the heart. There is a space, it's actually only a potential space, and it's filled with fluid, a lubricating fluid that allows the heart to pump without rubbing or being irritated by the pericardium. If you look at the layers that they show here, you can see the visceral covering of the heart. This is a section through the heart and the pericardium. Here's the cavity that's only the potential space, and this is filled with a thin layer of lubricating fluid that's regenerated and renewed all the time. And then you have the layer of the parietal pericardium, the wall, the tough end of that. Now, this pericardial anatomy has some aspects to it that lead to pathology, things that we can get in trouble. While it has given protection to the heart, it also has the problem that there may be too much rigidity, too much protection. For example, you can get something called pericarditis. The suffix itis means inflammation. Appendicitis, for example, meningitis, are all words you've heard. These just mean inflammation. Arthritis, inflammation of the joints. Pericarditis can be caused by viruses and other infections, and when the heart and pericardium become inflamed, they begin to rub and irritate. This causes chest pain. It can cause difficulty in pumping. It can cause the patient to have fever, infection, and other symptoms of severe illness. After the infection is over, the pericardium can scar down. This is called constrictive pericarditis and make it difficult for the heart to pump. The other side of this is what happens in our high-speed society. We have lots of things in our society that move at high speeds. One of them is the car, and we have steering wheels that are very close proximity to the chest. And in car accidents, before the advent of airbags, steering wheel injuries to the chest often caused injury to the sternum, and as you saw how close that was to the pericardium, tears or bleeding in the heart and pericardium. High-speed missiles that we get at the Friday and Saturday night knife and gun clubs, bullets, knives, clubs, also can injure the pericardium. And the result is that you can get blood in this little space right between the heart and its covering. If you look up here, that tiny little space is bounded by this fibrous, dense pericardium that doesn't really have any place to move. It doesn't have any give. Think now of the blood maybe leaking some blood, or a blood vessel, a tear in the pericardium, leaking into that space. It will start filling with blood under pressure. The heart will squeeze, which makes it smaller, and then there's blood in the space, and the heart can't expand. So it can't refill itself. And this immediately and very quickly leads to what's called pericardial tamponade. A tampon is something that presses. Tamponade means that the blood in the pericardium is pressing against the heart. This is a very serious situation. It requires emergency treatment, or death will ensue depending on the severity in a very few minutes. The treatment for this is to open the pericardial sac. A surgeon will take a knife, open the chest, cut a hole in the sac, and let the blood out, and then if it's done in time, everything would be fine. In an emergency room or a place that doesn't have the ability to open the chest, you might stick a very large bore needle through the ribs, into the pericardium, and if the blood hasn't clotted, it could come out and relieve the pressure. So those are the structure and the function of the pericardial sac. And then we get to the layers of the heart, which is rather simple, not very complicated. The heart is basically a muscle. It consists of 3 layers that we define and look at as all being separate with separate functions. There is the epicardium, epi meaning outer, and as I've just pointed out, that's really the visceral pericardium. It's a shiny, thin layer that you can see through. It's that thin. It's quite tightly adherent to the heart muscle itself. And if you tried to strip it away in the dissecting room, you would actually tear pieces of heart muscle. It does not have any give. It's an integral part of the heart. On the other side, on the inner wall,